I'm Barb Morgenstern, publisher of QueenCityPets.com. I'm here with my dog Yogi, who's the inspiration behind this dog blog, which features pet heroes and hero pets. We're in the veterinary oncologist office of Dr. Cheryl Harris, and we're waiting for one of Yogi's treatments, and I want you to shortly meet Dr. Harris, who is one of our pet heroes and is responsible for Yogi having a wonderful quality of life while he's getting chemo this whole past year. When the first vet I took him to said he would be gone in a couple days. Pretty soon, Dr. Harris will make her rounds here, and you'll meet our first pet hero.
Not really. Kelly.
So when you come in next time, I will be out of town, but Dr. Rogers will be here.
Oh, I love Dr. Rogers.
Right, so he'll be scheduled to have Dr.
Not more
Rogers.
than you, though.
Oh, good answer, good answer. So you'll be scheduled to see him, to have him ultrasound the spleen again and
Okay.
see what he thinks. And I'll have some notes for him, so he should hopefully be able to tell what's what. Oh, spleen actually feels really good today.
Yeah.
Yeah, you're a very good boy. All right, I'll
So,
do it.
Dr. Harris, could you talk to each other just for a second and say, when Yogi first presented, in just kind of a summary of Yogi?
Oh, wow. Yogi first presented with an abdominal bleed, with the history that we thought that he had two cancers, a cancer called a hemangiosarcoma and lymphoma. And later we determined that probably he just had the lymphoma that was involving his spleen, and that when it involved the spleen, it caused his spleen to bleed. And with chemotherapy, we've managed to make the spleen normal again. His bleeding has resolved, and he's been doing fantastic now for how long?
More than a year.
More than a year.
Yeah. When he was supposed to die in 3 days.
Yeah.
And Dr. Rogers was the first to give me hope
Yeah.
on that.
Yeah, because when he saw that he had lymphoma, and the prognosis for lymphoma is so good, he was like, well, let's try and treat this. And then when he did really well, he's like, well, maybe we should do just a little bit more than just the few drugs. So he's definitely a positive story. What do you have on you?
Oh yeah, we're gonna have to cut that out. We think it's cheese, frozen cheese.
Yogi.
By the way, dear watchers, it's the high of 10. Today is January 29th, and we've been having a polar.
Can you scoot him out?
No, he should be fine.
Yeah.
You know, it's amazing to me because it was supposed to be warm today.
I know.
And when I got up, my car said it was actually colder this morning than it was yesterday
Yeah.
morning.
Beth just came from California.
Oh, that must be a real shock.
Yeah. Oh, thank you.
Hey, what did you bring?
To cut out the
Oh,
frozen
good. I
cheese.
was gonna ask her to get the clippers for me, so she read my mind.
Oh, great. So I think it's really wonderful of you to get out on the floor and do the treatment for Yogi, Dr. Harris, because he hates the table.
No, you can't fall from the floor. That's my general rule with them. Go ahead and let us for a second. I don't know what they got in there or not. Let's see.
So Dr. Harris is doing the quote-unquote short treatment. We have a short treatment and then...
Yeah, we initially started off with a 3-treatment plan. The first drug was a drug called adriamycin, which is generally given slowly over 20 minutes. The second drug is a drug called Oncovin, it's also called vincristine, and that drug is repeated on day 8 and day 15. And then normally I use an oral medication called cyclophosphamide on day 10, but the concern about using the cyclophosphamide in Yogi is it causes a drop in the white blood cell count, and since he doesn't like taking medication, by eliminating it, we then eliminated his need to be on any medication between his treatments. So the goal here is that Yogi needs to be a happy dog throughout his treatments, and that's what we're shooting for.
And for other pet lovers out there, specifically dog lovers, I was not going to put Yogi through chemotherapy if he would not be happy. And I had no idea that dogs do not react to chemotherapy necessarily negatively at all. My mother had gone through chemotherapy for lymphoma, and breast cancer, and I was not gonna put Yogi through that. So part of this is to educate you that there's options for dogs that in some ways are more palatable or acceptable than,
Right.
yeah.
Because, I mean, Yogi's purpose in life is to be a happy dog. He doesn't have to hold down a job. He doesn't really want to wait to see if his grandchildren graduate from
Cheese off,
college. He's not awaiting the birth of his first grandbaby. His purpose in life is to just be happy every single day. And so, even though we want Yogi to live longer, we want to be sure that he's happy as he's living longer.
It's a free shave of frozen cheese.
Yeah,
And he gets a nail clip sometimes. I gotta
Does he
cut
use
the
it
rose
today?
again.
It smells like frozen cheese.
Could
It
use
doesn't-
a nail trim today.
Huh? He does?
I say could use when I see that.
Hey, but can you roll him over or have him stand up? He hates to stand up when he's here. He likes to be a noodle. He does. It's like
Let's rotate.
if I stand up, nobody can pet my belly.
Let's rotate.
Oh, there you go. There you go. Yeah, but we have to get all the cheese off. Goodness gracious, look at you. You're silly. Okay. I think you're cheese free here. Hang on a second.
You want your nail trim on?
Yeah.
Thank you. Get you a nail trim.
We do nail trims. We trim a little hair between the toes because the snow gets on those and then it hurts.
Is this their version of getting your nails done?
Huh?
This is their version of, like
Pedicures.
manicure, pedicure.
Exactly.
Thank you for doing that. Really appreciate it.
You've seen the dog be snow lame before? It's when they step in the snow and then they start limping and hold the foot up. And then what happens is that they get snow between their toes that freezes and so it hurts. When they lift the foot up, their body heat melts it. So then they put that foot down and then they start holding up the other leg. And it can be quite humorous to watch them attempt to limp on all four legs at
Wow.
one time. Did I forget some?
I don't think it's cheese.
You don't?
I don't know what it is. It doesn't look orange or yellow.
Well, it still can leave.
This is Kelly, right?
Yes.
You got a 50-50 chance that the person in the room is gonna be a Kelly.
Really?
I've got two Kellys.
That's so funny.
Yes.
What's the chances on that?
So, what are you gonna do?
I'm going back to school for nutrition, registered dietitian.
Excellent. Where are you gonna go? UC?
Well, I'd like to go to out west for school,
Oh, okay.
but I have to take all these prereqs